is there anything you would share about yourself that might not be common knowledge or that we might not have guessed? I don't know, something quirky, I don't know.
Okay, so I can beatbox. Do you want me to show you?
Yes?
Yes, okay. So
Okay, I was not expecting that. I don't even know what beatbox is, but it sounds interesting.
No, it's easy. It's actually quite funny.
Okay.
So I can teach you how to do it also if you would like to
sure.
learn. Born to be clever, to clever, to be to clever. Born to be clever, to clever, to be to clever. So yeah, that's my quirky little party trick.
Okay. I like it.
Okay, guys, are we ready? All right, showtime.
Welcome to another episode of Urpreneur. Today I have the pleasure of interviewing Dr. Shenilee Hazell. I'm going to allow Shenilee to tell us a bit about her background, where she's really from. I'm hearing a twang. So Shenilee, tell me about, what I'm hearing in that accent.
Well, so first of all, I'm from Trinidad. I grew up here and I moved to the UK when I was, 11. And I went to school there. I did my university degree there. I worked there for about 11 years. And then I recently moved back to home. I recently moved back home.
Okay. So what made you decide to move back to Trinidad?
Okay, so what it was is I was moving. I lived with my husband, and he had just recently qualified as a barrister, and he really wanted to come back home and practice. And I kind of fell in love with that idea of, coming back to the Caribbean. It was hot. I thought it would be a little bit of a challenge because, dentistry in the UK, I'd just grown so comfortable with it. And even though people told me, if you come back home, it's going to be so different. There's all these negative things that they were telling me. Mm-hmm. And actually, I kind of just ignored them and just sort of like, well, let me just try it out and see what it'd be like. Yes. And I got really excited and, I came back and honestly, I still believe that it's one of the best decisions that I've ever made.
So you came back. I mean, even though you were born here, you spent most of your life in the UK. So what made you decide to launch out into your own business? I mean, it's bold enough that you moved countries. Now to go and start your own business, what made you take the plunge?
Okay, so when I moved back, I had the incredible experience of joining a really good dental clinic, really good reputation. But it was a little different from what I was used to in the UK in terms of just the work culture, the type of dentistry that I was used to doing. And I thought to myself, I wonder if I'd be able to, go back there. And I kept toying and playing with the idea because honestly, I never thought that I would want to do my own thing. I was very comfortable with going to work and leaving dentistry at work and having a social life after. And I kept toying with the idea. I became a little more uncomfortable the more I thought about, I wonder if I can have my own brand, my own clinic.
Yes.
And eventually I just snapped and very impulsively left my job and just put about 6 months of solid work into strategizing, how I was going to do this thing. I got a friend of mine had an existing dental clinic with some extra rooms in it. And I said, I'll rent this room and I would operate out of this room. And, everything kind of fell into place.
Wow. So did you have support, when you decided to make the leap? Did you have the support of family and friends to cheer you on, or was everybody kind of like, no, what you doing, girl? You crazy? Keep your job.
I think because I was complaining a lot, and I think they actually did encourage me. They said, my dad specifically, he, in terms of financing, he kind of helped me in terms of strategizing, how I would go about doing it. And it's something that I kind of put my head down, and I worked, I saved, I used a lot of my savings in terms of getting that financing to get the ball rolling. Mm-hmm. I came up with a strategy whereby any kind of profits that we made, I'll completely plunge it back. So even though I wasn't where I wanted to be when I initially launched and I initially started practicing, the growth came very organically.
Okay.
I had the support of a lot of my friends and network, really supported me in terms of telling everyone about our clinic. And it's just a continuing growth that I'm really grateful for.
So having taken the plunge, what were some of the major obstacles you encountered?
We have all night.
Yes.
So basically, there are a lot of obstacles. I had to learn very fast, very quickly that working in the UK environment is very different to working in Trinidad in terms of getting things done, people replying to emails efficiently. The challenges I face every single day is the camaraderie within other dentists in my profession. So it's extremely competitive, and it has shown to just be a little bit disappointing in terms of, we don't tend to always support each other. So that would be one of my biggest challenge, because, from coming from the UK, different dentists, even though, you work down the road or you work here, we all tend to support each other and try to lift the profession as a whole. But that has been one of the eye-opening experiences practicing here. But even though that happens, I think our mindset is just to try and improve things and just try and change the script. So try to, for instance, when there's a bit of technology that we had the benefits of having the first in the Caribbean. So when it was launched, I invited all the dentists who practiced with that certification to come and actually experience what it was like and answer questions and just try and share the knowledge. And I think when you try to change the inclusivity of the technology, then it tends to just try and change things in general.
Have you had any pleasant surprises?
Yes. So I think in terms of being a boss and learning leadership, and I say learning because it is a continuing process, being a leader involves so many facets in terms of, having that emotional intelligence, learning how to interact with people who communicate in very different styles and switching your communication styles to suit. Seeing my team of staff grow and continuously grow has been just extremely rewarding to see. And building a team that is so motivated every single day to be better and to perform has been just one of the things I'm very proud of.
How other than the way that you interact with your staff, is it that you have a particular way you select the people who work with you, or were you just lucky? Or
I think it's a bit of both. I wouldn't say that I knew what I was doing when I was selecting the people who have blossomed, because sometimes most of the times I kind of was a lot of trial and error and learning very quickly what I wanted and what I needed for my vision. Okay. So that kind of equipped me with some skills in terms of sensing a certain work ethic or a certain work attitude. And a lot of the times it is just instilling that growth or that desire in someone. Sometimes you just have to wake up what's sleeping. So that is also a skill in itself. I don't know if you get what I mean.
Yeah, no, I get you totally. So, I mean, you've had a successful year,
Yes.
right?
Yes.
So, tell me about how the pandemic affected your business.
Okay. So it forced us to think outside the box, which I'm sure can be spread through all different jobs, basically. We weren't, because of the nature of our dentistry and our job in terms of interacting with patients, we had to think of how can we consult with patients. So we launched virtual consultations, and that involved, a lot of planning in terms of how we're going to actually make it viable, in terms of how we're going to have an effect. And we were able to kind of change our shift in terms of how we would do our consults and get patients consultations.
That's really good.
Yeah.
I mean,
we actually had quite an incredible response, because even patients from the Caribbean, we kind of touched into that market in terms of answering questions and just benefiting from the use of that technology to do so.
well, it makes perfect sense, though,
Yes,
especially for
absolutely.
people who don't like visiting
Correct.
the dentist.
Correct.
If you can do it virtually
Yes.
and create distance between you and the
Correct.
dental office,
And answer
that's great.
questions,
Yeah.
because that's one of the things. There's just, with the internet and trying to self-diagnose, there's just so many different things that you can think you have, and then you
Yes.
actually realize, okay, when you consult with someone, you speak with someone, it's something totally different. So able to answer questions and give information, which is what we are as healthcare providers, information givers, because we are seeing a change whereby historically people would just go to the doctor or dentist and say, okay, this is my problem, tell me what to do. Whereas now there's a lot more informed consent in terms of treatment planning. So you want to know all your options. You want to know what the benefits and the disadvantages are of each option. And that is one of the core things that we try to do, educate.
So, where ideally do you see the business in like another 5 years? What's your goal, your dream,
Okay.
your vision for the business?
My vision would be to increase access. So there are a lot of barriers to healthcare, to dentistry. There are a lot of barriers in terms of accessing basic healthcare. There is a lot of anxiety in dentistry. So that would be one of my main things, is to educate enough that people feel confident and comfortable actually booking an appointment with their dentist and actually turning up and going to get treatment or get a check if needed. So that has been the cornerstone of how we would, educate patients virtually or on our social media platforms, and to just encourage the ability so people can feel comfortable and confident in going to visit their dentist.
So, other than wanting to, I guess, mimic or replicate or create an environment that was more comfortable for you based on your experience in the UK,
Yes.
was it concerning to you that there are so many dentists and you're opening another dental practice?
Correct.
And how could you be confident that you were going to attract new patients or
Yes.
have patients, because I assume everybody already has a dentist?
Exactly. So that was the thing. So when I was actually moving to Trinidad, my uncle, who has been in dentistry for a very, very long time, actually discouraged me. He said, there's so many dentists in Trinidad. I don't think it's a good idea.
Uncle was just looking out for you, I'm sure
I
of it.
know, right? He said, you have a good setup in the UK. You're so comfortable. Everybody's trying to get out of here, And actually, my belief is that everybody has something different to bring to the table. Everybody is very different in their individual skills. Everybody has something new and different to bring to the table. So I believe that I had something different, and I believe that with all my experience and my background and just what I felt that I can improve, I stuck to that, and I was able to, I guess, execute my vision and be successful at it.
What would you say were the key things that translated to your business being successful thus far? Was it referrals? Is it, I don't know, what was it? Customer service? Making sure you have a presence? I don't know. What was it for you?
That's a hard question.
You can think about it.
Okay, so I think in terms of how I did things, I myself, I knew that I wanted to be different.
Mm-hmm.
I knew that I wanted to create a different environment. So my treatment room does not look like a typical dentist surgery. I try to make it look almost spa-like. Again, it just involved me kind of thinking outside that box and trying to, be different.
Mm-hmm.
In terms of where I think I want to go in the future, I want to always keep changing. I want to always keep improving, to keep evolving, because I just don't ever want to be, static and not changing and sticking to, okay, well, this is how I've always done it. I want to be able to have that motivation and to inspire that with my team members as well, to always be, evolving and improving.
Do you have other entrepreneurial dreams that you're nurturing, separate and apart from dentistry? Since you've tried your hand at this and you've done so well, and it seems to me you now have a knack for what works in terms of some of the fundamental rules of setting up and nurturing a good business. So are there other things that you have in your mind that you'd want to explore?
Absolutely. There are things that I'm very passionate about. Mm-hmm. And I mean, just in terms of tapping into my network of friends who are all very skilled in all their different fields, I would like to do a lot more to kind of give back. So in terms of inspiring younger people to pursue their dreams and giving them the confidence to do that, one of my things that I think I even was speaking to you about it a few months ago was to try and connect everyone who is somewhat successful in what they're doing and try to go around talking to younger people and trying to kind of give them our story, to inspire them, to show them that things can happen, and mm-hmm. if they follow what they want or their visions, then they can get some results.
Okay, so what's next? What are some of the things that you see yourself doing like in the next 12 months?
Okay, so actually this week, I told you last year I started off with one room. Mm-hmm. This week I'm actually moving my clinic to another location, which I'm going to have 4 separate rooms, and I have on board 3 other dentists who are going to help me kind of deliver the kind of care that I want to deliver. So in the next 12 months, I think just building on that and building on, as I said, improving what we can offer. Mm-hmm. And again, just continuously evolving and offering the very best that we can offer.
So how do you know when it's the right time to take on more risk? Because as you said, you had your one room mm-hmm. in your friend's dental clinic and it was doing well.
Yes.
I guess, one option could be, what? This working out well, let me just stick with this, versus mm-hmm. let me expand. How do you know when to take the challenge up a notch?
Okay, so it's a multitude of things that goes into something like that. Actually, with the rate that we were growing, I became a little bit more uncomfortable again. So I think it's a running theme. as soon as I get uncomfortable, I want to do more. I want to do something better. So actually, honestly, I was a little uncomfortable where I was in terms of where I saw us being. And I decided to take a little risk and move into a bigger space where I can have more rooms, more clinics, and actually train other dentists to, you know, do the type of dentistry that I believe that, you know, we can offer. So that would be the answer to that question.
Yes, no, it's a perfect answer. As a matter of fact, I'm learning more and more that discomfort is a good thing.
Yes.
Because you mentioned to me that when you were in the UK, you were super comfortable.
Very.
You loved the culture, the environment. You know, it was working for your lifestyle.
It
and
was.
that if you hadn't moved and become uncomfortable, you wouldn't have launched out into your own business.
Absolutely, yeah.
So it seems like that discomfort is a good telltale or a flag. Hello, it's time to change
It's time
something,
to
or it's
change
time
something.
to step up to the challenge.
Yes, absolutely. You've hit it on the point.
So Shenilee, as a follow-up question, I was wondering, let's say there's a dentist, or I guess any kind of health practitioner or professional that they've become uncomfortable or they're ready to pursue their dream and they want to start their own practice, but it just seems like a overwhelming, gargantuan task out of reach. How possible is it? Could you break it down, so that they could understand what's involved?
Okay.
Is it that there's a huge capital outlay required? Like
Right.
what really goes into something like that?
So definitely a lot of business planning. So before I even approached for financing, I had a full-on strategy and plan. I didn't start off with everything I needed. I started off with what was absolutely necessary.
Who taught you to do a strategy or a plan? Do they teach you that in dental school?
Absolutely not. No. But I knew what I needed to do. In terms of my stock levels, I was planning to see 3 to 5 patients a day.
Okay.
So I started off with everything I would need to see 3 to 5 patients a day.
Okay.
Some of the things that I had, I only had one type of instrument. So you'd find that, like in my first few months, I would be using this instrument and then autoclaving it and then scheduling my day so that I know that, okay, on this day, I can see this patient at this time and then this patient at this time. So it's a lot of strategizing that exists. In terms of the capital expenditure to start,
Right.
I definitely didn't have if you looked up on the internet what you would need. I started off, I had chairs and I used that to get a business loan. My business plan was very, very basic. I asked friends that I knew open clinics for their business plans, and I was like, okay. So I took little bits from, and I made it work with my situation, with what I wanted to do. Since I moved to Trinidad, I've been trying to get a certain bit of technology in Trinidad and Tobago, in the Caribbean. And I sent, from the very first week that I moved to Trinidad, I sent email after email thinking, how can I get this particular bit of technology in Trinidad? So this is a specific type of scanner that helps me offer a more optimum experience for my Invisalign patients or my clear aligner patients. And every single week I would check my emails. I would keep re-asking the same question, when can we get this? And I was hit with a lot of negativity, like, your market isn't big enough, the Caribbean isn't big enough, the market is not the same as the UK. And I formed business friendships with my territory managers for the clear aligner system that I use.
Right.
And I would, talk to them. I would say, when are you going to push for this? And I would kind of make it into a joke. And I actually never thought that we would be able to get this technology in Trinidad or in the Caribbean. And there was one time I made a joke and, he said, we had a little change in plan. You may be able to have the first scanner in the Caribbean. And I laughed because I just thought this was ludicrous. He's joking. And it came about the time when I was starting to get really, really uncomfortable in my very first job in Trinidad. And the following week, he gave me the news. He said, Doc, you know, you've been approved. You'll be the first person with this particular scan or this bit of technology in the Caribbean. And then I thought, oh my gosh, I have to do this now. I have to.
Okay, yeah.
So that was, I think, the kind of spark that ignited me to think, okay,
yes.
I need to do this. You
Okay.
know, so did that answer your question?
Yes, it did, and it gave me some additional insight in terms of how you knew it was the right time.
Yes. Well, I mean, I did have the experience in the UK of using this bit of technology, and I saw how it worked, and I saw it working in that market. And actually, since then, now that I was the first person, I think now there's like at least 6 other dentists with it, and it's really nice to know that, you know, you're able to allow other dentists to have this technology to, you know, offer patients a better experience.
Yes. What about dentists who want to start and don't have capital? What are their options like? Because it just seems like a capital intensive industry. You know, you need scanners and chairs and you know.
Well, how I did it is I came up with a plan, as I said, as what's absolutely necessary. I didn't purchase all my equipment outright. I actually had a financing plan for the big ticket items.
Okay.
So that actually helped.
Okay.
And working out something that would fit my budget if I saw, you know, X amount of patients. And just, really sitting down and with the figures on the calculator and thinking, okay, well, I'll need to do this. I'll need to have this amount for, you know, overheads. I would have to save up this amount, you know, because I did do some meetings and I went and I did shopping around and I, you know, did some homework before I was like, okay, I'm going to do this. So it's a lot of homework, I think. And even if they don't have it, I would say not to give up hope, because I think everyone can achieve it and everyone can be their own person, their own entrepreneur in dentistry or any other field. It just involves, I guess, just sticking to your vision and sticking to trying to execute it.
Okay, so in taking on these risks, right, how do you control your anxiety or your fears that come with the risk? Because yes, you've taken on this challenge, but in the back of your mind, I suspect you might be wondering.
I think of everything that can go wrong. That's how my brain works. So I think of every single thing that can result from making this one decision. And one of the things that I really believe in is just looking at the bigger picture. So yes, there's obstacles on a daily basis, on a monthly basis, and just overcoming those, just taking one step at a time, actually helps me kind of focus on the bigger image and the bigger picture that I want to, I'm sorry to be poetic, but to paint for myself, you know, because I mean, I said it before that it's not an easy, it's not all, you know, a bed of roses. There is, what I have experienced is professional jealousy. I've experienced just the learning curve that comes with inspiring my staff to work, to be punctual, to have a certain standard of care and professionalism. And it's something that, you know, I think it just comes with practice. You just always going to improve the more you kind of plunge yourself into doing so.
What kind of support do you think entrepreneurs like yourself need?
I think mentorship helps. Mentorship really helps. I mean, what has worked for me is to tap into my network of friends and family who live here, who have businesses here, and kind of learn, not only get the actual contact networks to get things done, but also to learn from their experiences. Even some of my patients, like every day I get to meet different patients, different people. And, you know, one of the things that also comes with the report is getting to know them and getting to know about them. So I learn something, even if it's, to learn how to manage, I don't know, anxiety, and to learn how to manage a difficult situation. I learn so much every single day just by tapping into, as I said, my network and getting that, they give that support to me. So, yeah.
Would you advise young professionals to take the leap and start their own practice, or do you think it depends? And if it depends, what does it depend on? Depends on
right.
What?
So I feel like if I looked back at because I've been in dentistry for a little while, right? So I've been in dentistry for 13, coming up to 14 years. I don't feel like I had the experience if I was looking back at myself, to go in like after 2-3 years. But that's just me. I wouldn't discourage anybody from following their dream. And I believe that if you have the right support, I believe in mentorship. I believe in, getting into contact with someone that you admire, or getting not just one mentor, but more than one, and using that to learn how to navigate your way in the business world.
Do you think to manage a business that you need to have a business background, or have you had to take business courses? Because I know many people are like, I'm a doctor, I don't know anything about business or managing accounts or marketing or So I've had to learn to delegate a lot, because I realized that, some of the things that I thought would, have been in dental clinics for pretty much all my working life, I should know how this, but that's not how it works. I realized really quickly where my strengths and weaknesses lied, and I thought, okay, well, I'm going to need to get XYZ or get this advice from this person, and actually delegate a lot more than trying to take everything on myself. So that has helped a lot. In terms of having a business background, I don't think that's necessary. I mean, we have the internet. True.
I listen to podcasts a lot. There are a lot of podcasts that have helped me improve my leadership and I guess just business acumen. And again, like mentorship, like I get a lot of advice. There are people that I call for different advice for different things, depending on what my issue is.
Okay, all right. Are you thinking of doing any other business that, let's say, complements your business separate and apart from dentistry?
Absolutely, because actually being in this field, you get to see the weaknesses, you get to see where things can be improved.
Yes.
So not just dentistry, sort of dental supply, or actually training and offering educational seminars for younger dentists to kind of pass on all the stuff that, I've learned over the years from attending all these courses all over the world. And I believe that that is the only way to kind of raise the bar, to share the knowledge,
Okay. Very insightful, Shenilee.
Yes.
So, for our viewers, is there anything you would share about yourself that might not be common knowledge, or that we might not have guessed? I don't know, something quirky, I don't know.
Okay, so I can beatbox. Do you want me to show you?
Yes?
Yes, okay. So
okay, I was not expecting that. I don't even know what beatbox is, but it sounds interesting.
No, it's easy. It's actually quite funny.
Okay.
So I learned to beatbox a few years ago, where I can teach you how to do it also if you would like to learn. Right, so you basically say a sentence.
Yes.
And you basically enunciate the B's, the T's, and the C's.
Okay.
So the sentence that you say is, born to be clever, too clever to be too clever. All right, you want me to demonstrate how you say
please.
it? Born to be clever, too clever to be too clever. Born to be clever, too clever to be too clever. So yeah, that's my quirky little party trick.
Okay. I like it. All right, so come all right, let me try it.
Born to be clever, too clever to be too clever.
Born to be clever, too clever to be clever.
Too clever to be too clever.
Too clever to be too clever. Okay. Born
You
to
want to
be
do
clever.
it with me? We could do it together.
Too clever to be clever. Okay.
Yeah, ready?
Okay, so I have to do it like a...
Like your beatboxing. Ready?
Okay, right.
Born to be clever, too clever to be too clever. Born to be clever.
I can't do it with a straight face. All right, come
Ready?
again.
Born to be clever, to be clever. Born to be clever, to be clever. It sounds like beatboxing, right?
Okay. Thank you. I definitely learned something new.
You wanted something different, right?
No, I love it. And I would never have guessed. Oh my gosh. Thank you so much.
You're welcome.
Shenilee, for not only insightful, but very entertaining episode. Thank you for joining us for another exciting episode of Urpreneur. We heard it all today from Shenilee. It was great to know that, you could just go for it when you feel that discomfort, when you feel the nudge to pursue your dreams, to start your own venture. And of course, we learned how to beatbox. I never thought I'd learn that. So, guys, looking forward to seeing you on our next episode. Take care.